If a simple treatment could save your life, why would anyone not take it? Thousands of people with diabetes fail to stick to their treatment plan.
I resisted it until it put me in the hospital.
More than half of those on insulin admit to intentionally skipping injections.
I was worried about side effects from the insulin, especially gaining weight.
Avoiding treatment can result in serious complications.
I didn't believe insulin really was going to help me.
The irony is that diabetes is a very manageable condition.
I've had trouble planning my life around my diabetes treatment.
Yet not even 1 in 10 people with diabetes manages their care properly.
My treatment was too complicated and became a hassle.
These 5 people have all struggled with adherence to their treatment plan. Each faces different obstacles, but each is also finding real-life solutions to overcome them.
I produce fashion shoots, fashion shows, so I pull wardrobe, select models, design the set, and direct the photo shoots and shows.
Reese Randall is managing editor of Pittsburgh Magazine. Fashion writing is her specialty.
I manage the style pages where I look at clothing and edit products down and write about those things each month. It's fun, it's very creative. I enjoy it. But family is the most important thing.
At age 35, Reese and her husband Marvin have 2 children, 10-year-old Marissa and 4-year-old Miles.
We love to go to the library, go to the park, and read stories together.
It was soon after Marissa was born that Reese found out she had diabetes.
When I was diagnosed with diabetes, with type 2 diabetes, it was completely a shock.
Reese was devastated. She lived a pretty healthy lifestyle. So for her to be diagnosed as a diabetic was very traumatic for her.
Reese is among the nearly 10% of the world's population with diabetes.
Diabetes has assumed epidemic proportions worldwide, and the United States is no exception. We have 24 million people with diabetes in this country.
Dr. Helena Rodbard is past president of the American College of Endocrinology and the American Association of Clinical Endocrinologists.
Every day, 4,368 people are diagnosed with diabetes. So while people are watching this program, in the next hour, 200 more people in the United States will be diagnosed with diabetes. It's really dramatic.
While there is no cure for diabetes, it is manageable through medication, diet, and exercise. But that management must be self-administered. Left untreated, diabetes can lead to serious complications or even death. Like many others, Reese has had trouble managing her treatment.
When I found out I had diabetes, I was in denial, and I still am. There was a piece of me that was over. Life was over for me. And I didn't want to have to worry about what I should be eating and what I shouldn't be eating. I didn't want to have to worry about taking medication.
Reese reacted as if her fate was sealed. She didn't alter her diet. She was lax in taking her medication.
I missed a few doses, you know. I slacked on that as well, truth be told.
And she started losing weight rapidly. But she liked the way she looked and had little motivation to change.
I really didn't have an incentive to be on a strict regimen because I was losing weight, and to me, I equated being smaller with looking better and then having the image of being healthier. So I had dropped from a size 12-14 down to a size 4-2, and it was, I'm ashamed to say, a great feeling for me.
Reese's lack of motivation was a major obstacle to treating her diabetes.
She was feeling really good about herself because her body changed. but it didn't change because she was actually doing something about it. It was a result of the diabetes.
Reese also had a second obstacle to adherence: low expectations of how effective insulin would be.
I probably had zero expectations about my treatment.
Reese's obstacles, low motivation, and low expectations of insulin are just two of many reasons people with diabetes don't adhere to their treatment. Others include a lack of confidence the treatment will work, anxiety over potential side effects of taking insulin, difficulty planning life around treatment, and feeling overwhelmed by a challenging drug regimen.
Non-adherence is the major problem both in type 1 and type 2 diabetes.
Reese's endocrinologist is Dr. Vijay Ball of the University of Pittsburgh Medical Center.
Only 30% of the diabetic population is at goal. Unfortunately, as you're postponing your insulin therapy, the complications are setting in. They are silent complications. You may not be feeling a whole lot, but the blood vessels in the kidney, in the eye, the legs, in the heart, and the brain, they are all gradually closing.
The reason? In people with diabetes, the body doesn't properly process food, leaving sugar levels in the bloodstream too high. Normally, the body breaks down food into sugar or glucose, which enters the bloodstream. The pancreas responds to the rise of glucose in the bloodstream by producing the natural hormone insulin. Insulin is the key to the body's cells accepting glucose to be used as energy.
There is overproduction of glucose and underutilization of glucose. And basically, the final end product is an individual does not produce enough insulin.
In type 1 diabetes, the body doesn't produce enough insulin to allow glucose to enter the cells, so glucose builds up in the bloodstream. In type 2 diabetes, more insulin is required because the cells become resistant to it. Without enough insulin, glucose builds up in the bloodstream, commonly referred to as high blood sugar.
People who are compliant with their diet, compliant with exercise, compliant with injections, have significantly superior control than patients who are non-compliant.
Reese's non-adherence left her diabetes in poor control. Her blood sugar levels continued to be 2 to 3 times higher than normal, and her hemoglobin A1C, which measures average glucose levels over a few months, was about twice what it should be. Below 6.5 or 7% is considered under control.
How have you been? Reese came to me and said that she had diabetes for about a year. But I think her control was not optimal. So she was seeking advice on how to improve her control.
But against her doctor's advice, she refused to take insulin.
She had no motivation at that time for insulin use at all. And she was fearful that the insulin therapy for her will not work. Her anxiety about the treatment played a major role in her being non-compliant.
I went between being defiant of the regimen and just ignoring it.
Ignoring her regimen finally caught up with her in 2005.
I was feeling really, really, really sluggish.
Her blood sugar hit near fatal levels, and her body was shutting down. It was a crisis that not only threatened Reese's life, but changed it forever.
I couldn't talk, I couldn't look up, my head was hanging, I just was barely making it.
I knew that she wasn't feeling well. Early part of that day, didn't really think anything of it, thought it was the flu.
Okay, let's go.
Well, next thing I remember, I was in the ER being admitted. I felt like I was on my deathbed.
It was a very scary moment for our family.
When I finally came to, the doctor told me that if I had waited even 3 more hours, I would have died. And that's when it hit me how terrible I had been toward my body and with the disease and how negligent I had been.
Her non-adherence almost cost Reese her life, but it was a turning point for her accepting insulin.
It was a humongous wake-up call, and I know that my time of being irresponsible is actually coming to an end.
But Reese soon learned she had more adherence obstacles to overcome.
The impact of diabetes in society is overwhelming, especially now considering the number of people that are at risk for diabetes. Right now, diabetes is the 7th leading cause of death in this country. In addition, it's a very expensive disease, both from the financial point of view as well as the impact that it has on people's lives.
60-year-old Charlie Bates knows all too well the importance of consistency and control, especially when it comes to his diabetes.
Well, when I first get up in the mornings, I first check my glucose level. After checking that, I jump on my treadmill.
He was diagnosed with type 2 diabetes in his late 40s.
Take my oral medicine in the morning, and each time before a meal, I take my short-term insulin because that's what keeps the sugar level down.
Charlie works tirelessly to juggle his treatment regimen around his job as a bus driver in Charlottesville, Virginia.
I have to admit, I've come a long way from where I was as far as dealing with diabetes.
But it wasn't always this way. For more than a decade, he was unwilling to accept his diabetes. This was the beginning of his struggle with non-adherence to treatment.
For a while, I ignored it. For quite a while, I ignored it because it was hard to accept. Well, good morning, sir. How are you? Just fine, sir.
Charlie's been behind the wheel for his entire professional career.
I started out with my dad sitting in his lap driving track and trail at night. Then I went from there into bus driving, and today I'm a bus driver. I love doing it because you get an opportunity to really meet a lot of people in the community. It's a great job. Now approaching 8th and Main.
Yet, as conscientious as Charlie has always been about his job, he denied his diabetes and ignored his treatment for years. This left him open to some serious symptoms.
You know, I could sit in the seat of a vehicle and you feel the tingling in your feet and your leg is feeling like it's trying to go to sleep.
And as a professional driver, he understood the consequences.
You know, you could pass out, you could go into a diabetic coma, and sitting behind a wheel with other people's lives. It's a scary feeling. So you focus on yourself. Getting healthy.
Ironically, Charlie was no stranger to the effects of diabetes. His mother suffered from it for years.
Because she ended up on the kidney machine 3 times a week. She was on big doses of insulin.
And that left him with doubts around how effective insulin treatment would really be.
I didn't feel like it was effective for her. I didn't feel like it was going to do me any good.
It's a common misconception that can lead to poor adherence, says Charlie's endocrinologist, Dr. Anthony McCall of the University of Virginia School of Medicine.
He had the sense that his medications could harm him, and it was not clear to him that they were helping him, in part because they just weren't enough for his needs. And so it's easy to become suspicious and fearful in such situations.
When you look back over it, it was doing her some good. But she didn't follow through completely on the procedure it took to fight diabetes.
Still, Charlie avoided treatment. But it was education about diabetes treatment adherence that helped Charlie overcome his lack of trust that insulin would help him.
Hi, Mr. Bates. How are you?
When he came to see us, he did so in the hope that somehow we would help him to understand what was going on and thereby help him to develop and understand his own motivation for self-treatment.
All right, well, come on back. We're going back to room 3. And
If you can educate somebody as to how to do these things and support them in their decision-making and guide them to improve their self-care, then they get to take the credit for the stuff being good, and they feel rewarded because you've helped them, but they've still done it themselves.
And I've fought that for months. But my team kept working with me, but they wouldn't push, but they kept working with me. Came to the conclusion, let's go for it. What is the greatest fear? Of losing your life or using that needle to save your life? Because 2 hours later I can take it.
He started to have a little more faith as he got more understanding. And by the time he got on effective doses of insulin, then it worked. And he was able to see the benefit when he measured his blood sugars.
Still, Charlie's work schedule sometimes made it hard for him to take his mealtime insulin. So doctors also adjusted his treatment regimen to help him be more adherent.
One of his challenges is that he will have a bite of a sandwich every time he stops his bus. Well, you can't give yourself insulin to cover that. That doesn't work. The better approach for most people is to give them a flexible therapy with insulin that allows them to adapt the therapy to their lives. Once he got on a flexible regimen suited to his lifestyle and his work as well, he's been much better. He's improved by several points in his A1C.
As Charlie took control of his treatment, he began to get control of his diabetes.
And I think he decided that he was going to face this, and rather than have it control him, he was going to control it. Now he sees it working. He sees his blood sugars don't get out of control, and he's becoming more motivated to do additional things.
Additional things, like explaining to family and friends the importance of sticking to treatment.
That many of his friends and relatives with diabetes, as he started to talk to them, had no idea about the potential benefits of taking their medication like this.
You always want to check because that is a silent killer. And believe me, I know.
Once in denial of his diabetes and distrustful of his treatment, Charlie is now on the road to acceptance and adherence.
It's joy to live happy. It's joy to feel good about yourself. And most of all, it's joy to know that no matter what problem you're faced with, you can overcome it. And right now, my biggest battle is overcoming diabetes, because I know there is medication out here that can help you overcome this thing. And that's why today I'm doing everything I can to deal with this issue head on.
The consequences of not being under control is more retinal disease, more risk of amputation, more risk of cardiovascular disease, more risk of kidney disease. So we don't know for sure who will pay that price, but statistically all of those things are more common with less good control.
I think that was better.
That purple. You like that?
Sherry Danner Murphy and her husband Stephen love to go antiquing, hunting for hidden gems near their Northern Virginia home.
Ruth's looking at the glass. It's beautiful.
And Sherry has her favorites: period glass, furniture, and jewelry. But behind Sherry's smiles are negative feelings she harbors around having type 2 diabetes. It is another reason patients with diabetes don't adhere to their treatment. The discouragement Sherry feels is so strong that she hasn't completely complied since she was diagnosed 8 years ago.
I became dependent on insulin within a year and a half, and I was pretty dismayed. It's like, why try? Why try? Taking the insulin, I sort of felt, okay, like this disease has already beat me. The sadness and the frustration at, okay, I have to give myself injections and I'm gonna have to give myself injections every day for the rest of my life was very discouraging to me.
Sherry and Stephen have 2 daughters, 19-year-old Jessica and 20-month-old McKenna.
Everyone in my family knows I haven't been taking care of my diabetes. And I have a history of not consistently following through with what I need to.
I'm extremely scared and worried about her. I'm also hoping that this is a reality check.
In fact, Sherry just got out of the hospital after recovering from life-threatening dehydration caused by extremely high sugar levels in her blood. It was a direct result of not adhering to her insulin regimen.
I became very, very sick. Right before my hospitalization, I was probably taking 1 injection every 3 or 4 days when I really needed to be injecting 3 times a day. It's been a huge struggle. Out of control diabetes, it's dangerous. I'm risking my life. I can't deny that I have a disease when my body's shutting down.
But Sherry is now starting a series of new steps to help her adhere to treatment.
Despite how you feel, you need your insulin.
Among them,
It really works well.
one-on-one counseling,
Right, but you need it every day for each meal.
She's also taking refresher classes.
People have adherence to insulin issues, and some of them include
Classes that teach people with diabetes about sticking to their treatment on all levels, from diet to exercise and medications.
Patient education is essential in improving adherence.
We want you to know that you're not alone.
If it's depression related to diabetes per se, we can discuss the issues. And actually, I like to leave my patients with a message of hope that there is so much we can do nowadays to improve the lives of people with diabetes.
The other lesson Sherry's learning is how to get past her second big obstacle to adherence: anxiety over the potential side effects of taking insulin. The one at the top of Sherry's list, weight gain.
And I would try to see, oh, maybe I can take less insulin than what I need to. There were periods of time where if I wasn't taking my insulin, I was losing weight. That was dissuading me from following through on the insulin like I should.
People struggle a lot with anxiety over potential side effects of the medications. Weight gain is an issue that's associated with insulin, but if we use just the right amount of insulin with appropriate lifestyle modifications, people do not necessarily need to gain weight.
Modifications like regular physical activity and better eating habits.
One of the things I'm trying to do with the diabetes is start eating healthier.
Look at these peppers.
We have a really nice farmer's market.
Here. Ooh, you want to pick out green beans?
For me, it's more vegetables. Different vegetables, learning how to cook with them.
Living with diabetes does not have to be difficult, particularly when people realize how much better they feel if they adhere.
Those are nice. I like those.
And while Sherry's learning to stop avoiding insulin and to live a healthier lifestyle,
These are really good. These are delicious.
she's also working to break down a third barrier to adherence: avoiding her doctor's appointments.
It's embarrassing to go to the doctors, every few months and be told, okay, Sherry, it's, worse than last time. What are you doing? Do you want help? And my plan really was to, if I moved it back a few weeks, was to really get things under control for those few weeks so that I can say, look, I've been doing better. Look, I've been doing what I need to be doing.
So tell me a little bit about what happened before you came into the hospital.
Another change, following her recent health scare, doctors added a long-lasting insulin to Sherry's regimen.
And we like that one because it lasts 24 hours. So it's more like how your normal insulin would act. Okay. And hopefully that will really work with your lifestyle, with the kids, and with the regimen.
Okay.
How often were
The physician needs to listen to the patient and try to simplify the regimen and try to adjust it as much as possible to the patient's lifestyle. If patients know why they are doing certain things and what are the benefits anticipated from certain medications, they are a lot more likely to comply.
And both Stephen and Sherry are seeing the first positive steps toward compliance.
I sort of joke with her at times that McKenna wants Sherry to see her graduate. And, you know, we've got quite a ways to go. McKenna's only 20 months old now, so she's got to take care of herself for quite a while to be here to see that. And that's just, you know, the first benchmark that we want to hit.
My sugars have been, you know, perfect. And my family's all happy for me. I mean, they genuinely are, you know, like, yay, yay for mom, yay for Sherry. And that's motivating too.
Sherry knows that the support from her family, one-on-one counseling, and her group classes are all adding up to an improved outlook and increased adherence.
I believe that this is really the turnaround for me. I want to live my life and be as healthy as possible. And the only way that I can do that at this point is to really take this disease seriously and start with just taking care of myself, taking the insulin like I'm supposed to.
It's extremely dangerous to skip intentionally or non-intentionally insulin injections. This inevitably will lead to poor control of diabetes, and it will lead to complications of diabetes, the retinopathy, neuropathy, nephropathy, heart attacks, strokes, and all of those dreadful complications that are so preventable nowadays.
Reese Randall recovered well from her brush with death caused by non-adherence to her diabetes treatment.
I was completely non-compliant to the regimen, to taking my insulin, to testing my sugars. And that's when I went DKA. Diabetic ketoacidosis.
She was admitted as an emergency in a condition called diabetic ketoacidosis, which is extreme form of insulin deficiency, where the body is absolutely unable to utilize glucose. The resultant blood sugars are 500 to 600 milligrams percent, and it's not compatible with life.
Reese's crisis had a profound impact on her motivation to take insulin, and she learned something new about her condition.
She really was not type 2 diabetic, that she really was a type 1 diabetic.
There is another condition that's called latent autoimmune diabetes, which actually has the acronym of LADA. And what it is, it's truly a person that has type 1 diabetes, but it's a very slow progressing type 1 diabetes.
Reese fully accepted her new diagnosis of slow onset type 1 diabetes and began adhering to her stepped-up insulin regimen.
My resistance to taking insulin waned because I had to do it. And I did, and I did great. I took my mealtime insulin and my basal insulin and testing my blood sugar levels.
By taking her insulin and seeing results, Reese overcame one obstacle to adherence: low expectations that insulin would work for her. And she felt much better when she was sticking to her plan.
I felt great. I felt like $1 million, so it was good.
Taking her insulin did make her healthier, and that's when Reese got another surprise. This time, it was good news. She was pregnant.
And during my whole pregnancy, I was the model diabetic. Diabetes didn't seem like a hard thing to handle when I was pregnant because something more important took its place, and that was making sure that my baby was healthy.
But soon after Miles was born in 2006, Reese's incentive and motivation to stick to her regimen dropped.
She was A+ with adherence, compliance, and motivation. But unfortunately, as time went by, the compliance to food, the compliance to blood sugar monitoring, injecting insulin at the right times, taking appropriate amount of insulin at right times went down the drain.
As Reese's motivation slipped, so did adherence to her diet and treatment plan. She also started to struggle with another common obstacle to adherence: an unwillingness to monitor her blood sugar levels.
I go through pockets of monitoring. I know exactly my body and the different signals it's sending to me, where I can gauge actually if I'm having a high blood sugar level or if I'm dropping.
You should not guess, not in a type 1 patient, because the sugars are too fluctuant.
Gauging or estimating how much insulin you need instead of testing for the exact dose can have consequences.
It just hit me. I feel funny, you know, drunk. I'm not a drinker, but it feels as if what it would feel like if I were intoxicated. I think I probably have to take insulin soon.
Monitoring of blood sugar in a type 1 diabetes is critical. So people who do not measure their blood sugars enough are taking just arbitrary fixed doses of insulin, which may or may not be effective. So control can only be improved by multiple injections of insulin preceded by multiple estimations of blood sugar.
Reese knows her adherence is not under control.
I am not on top of it at all, and it actually is a second thought instead of second nature.
Not staying on top of her treatment is already taking a serious toll on Reese's long-term health. Her non-adherence has triggered early signs of the complications of diabetes. Numbness in her limbs, blurred vision, and injuries healing too slowly.
You know, if you watch your blood sugars now, it will pay off dividends heftily over the next 20 years.
Reese admits that she's not sure why she hasn't regained her motivation to follow her monitoring and insulin therapy.
I don't know. I have 2 beautiful children. I have a husband who loves me. I have a great family. I don't know.
But Reese is hopeful that she can turn things around.
I want to be better. I don't want to not adhere to my regimen. I want to do what's right.
Reese is about to meet with her doctor again to try to search for new options and find solutions to help her overcome her obstacles to adherence.
I have a strong, positive feeling inside that I'm almost ready to finally get over the hump. I have to.
I don't think there's any one magic bullet for every person, but sometimes an individual instruction and fine-tuning of their strategies based on working with a diabetes educator can be critical. You can go from very small chances of success to mostly quite successful.
3 nights a week, Erica Orton skates at a Minneapolis roller rink.
I think people need a way to get frustrations out of their life. It's a really consistent, tough workout that I know is going to happen 3 days a week.
At 28 years old, Erica's been battling with other roller derby skaters for more than 6 years, while also battling diabetes and maintaining her treatment. But after 18 years, Erica's finally overcoming some of the obstacles that made adherence difficult. Embarrassment over her condition and her treatment, and the interference they cause with daily life. A recent study shows these are 2 of the most common reasons people don't stick to plan.
Yes, T-shirt day.
Erica's struggle with adherence to treatment began soon after she was diagnosed with type 1 diabetes at 10 years old.
I remember being scared and nervous, but I don't know if I understood completely at the time the seriousness of it. It was a little bit of an awkward time, I guess you could say. My adherence to my regimen in middle school wasn't great.
Erica admits it today, but wouldn't back then. Her #1 obstacle, embarrassment about her condition and her treatment.
I made sure to kind of keep it to myself. Never took shots or took insulin in front of people. I definitely think that my not wanting to bring my diabetes sort of to the forefront of my life definitely was an obstacle. I was less likely to interrupt what was happening to go take care of treatments.
Embarrassment and a person feeling stigmatized is actually quite common, particularly among teenagers or even people newly diagnosed with diabetes. They think that there is something that they have done wrong, they feel at fault, but in fact, it's not their fault, it's a disease that just happened.
But learning the serious impact that avoiding treatment can have and finding friends and support groups to help her overcome the shame she felt helped a lot. Still, it took years to get past it.
I'm much more comfortable with my diabetes now than I was growing up. It's not really something that I'm embarrassed about. It's also something that I don't think defines me as a person. So it's just a part of who I am.
Despite remaining active through college and beyond, Erica had trouble managing her diabetes. Her inconsistent schedule was a major obstacle to adherence.
That's impossible.
Kristen Friend has known Erica since childhood.
I think I've known about the diabetes pretty much since she was first diagnosed.
For years, she witnessed Erica's trouble sticking to her plan.
The busier that she got, the harder it was to manage her disease.
Self-management is actually critical to diabetes because it really is the way the disorder is treated successfully. One risk that they run will be that they will wind up sick.
And that's exactly what happened to Erica. After starting her career as a teacher, it got even harder to balance her life with her treatment. It didn't go well.
It was hard to stay with my regimen being a teacher. I did have one point where I got extremely sick because I had left my insulin at home, and I was so weak from having been sick all day that I collapsed.
This time, Erica got the message.
They told me at the hospital that I could have died if, I hadn't come in when I did. And I think it taught me that I have to find a balance in my life.
To help her find that balance, Erica decided to make some changes.
I had to reevaluate the way that I was taking care of myself. As my life changed, so did my treatments.
Erica found another answer to adherence in a job change. She now teaches children's programs at a museum, which gives her more flexibility to manage her treatment during her workday.
People lead hectic lives, juggling a lot of things, and sometimes they just take diabetes for granted. They have to plan accordingly, and if they plan, not only are their lives going to be better in the short run, but in the long run, they will be preventing complications of diabetes.
I think the key to managing my diabetes is that I'm following a strict regimen and trying to stay relatively consistently in the way that I live my life. So that means, regularly going to my doctor, having, very healthy relationship with my food and my schedule, and just kind of trying to stay very regimented.
To help stay regimented, Erica also now takes advantage of technology. She uses online tools to help track her food intake and count calories every day. And she gets plenty of exercise.
I honestly think roller derby is a huge help to my diabetes maintenance.
Erica says her new approach to overcoming obstacles and adhering to her treatment is working.
Eating well, getting plenty of exercise, following a really specific regimen, staying focused. And I really feel like all of those things have come together to not only make my diabetes more manageable, but, make me a healthier person.
Communication is absolutely essential, and in diabetes, the treatment needs to be customized. It's very important that there will be open lines of communication, that the physician understands what are the patient's expectations, and the patient needs to understand how much is doable and achievable.
I was a professional chef or in the industry for close to 20 years. What I loved the most about being a chef was the creativity and the rush.
All right, boys up.
Creating something that's just new. I love it.
56-year-old Peter Marr has since moved out of the kitchen and into banquet halls as an events planner. His job mixes his love of cooking with another personal passion, music.
My job actually is planning conventions and meetings for an association of church musicians. And so it allows me to be involved in music, working with musicians, and doing food.
What Peter didn't plan for was being diagnosed with type 2 diabetes.
I have family history of diabetes, but I didn't think I was going to be diabetic.
Before he was diagnosed, Peter was an avid cyclist in excellent shape.
When I was about 43, I went down and turned out that I had torn the meniscus. I'd always been a thin person, and I started gaining weight.
Hampered from exercising by his injury, Peter's weight increased as his diabetes progressed. He had questions about his condition, but didn't feel he was getting answers.
I just didn't feel like I was getting information that was useful to me. It started to build up distrust.
That poor communication with his healthcare providers left Peter less and less willing to stick to his treatment.
I was saying, how come I keep gaining weight? We keep adding this insulin, we keep adding drugs, we're doing all this, and yet I'm not getting any better. What can you tell me? And they'd say, well, you need to lose weight. Well, how? They weren't giving me answers that really were addressing my issues. I was injecting myself 4 different times a day with 3 different kinds of insulin, and I was just like, what? It's not doing anything. So then I'd stop.
Frustration over communication and his discouragement over a growing treatment plan were the 2 obstacles that drove Peter to finally give in and give up on insulin.
You can darken these, right? I found myself making excuses not to take insulin. I can't take it to work. Oh, I'm going out to dinner. Whatever excuse I could find. The other thing was I wasn't monitoring my blood sugar at all.
But in one day, things started to turn around.
My general practitioner, he said to me, go see this doctor, Zangane, and, give him a chance.
Dr. Farhad Zangane is an endocrinologist and an assistant clinical professor at George Washington University School of Medicine.
We need to define the problem, explain everything to the patient, and with education, we can empower the patient to understand what the philosophy of care is, and therefore you partner with the patient. How do you feel, though? Forget about all the numbers.
Peter's chemistry and communication with Dr. Zangane was the first key to sticking to his treatment.
And we started communicating more, and it was kind of fun.
Trust is developed over time, and of course we didn't get good results initially. There was a lot of hard work. We ate a lot of humble pie early on because the numbers did not improve. Insulin requirements did increase.
But a more complex insulin regimen would not be the answer, because that was one cause of Peter's poor adherence.
We started on a program of treating the disease and also education. He recommended a different nutritionist for me to see.
It's not all about the sugars, right?
We tried a different approach.
Really important for diabetic weight loss.
Did I do anything with that? Probably not at first. It was still my history of frustration with everything. I started being compliant probably 1.5 years, 2 years ago, to where I would, okay, I'll go through the regimen. But I wasn't doing my part to beat the disease. I peaked out at 370. Carrying that around when I used to be 150, 160, it really was killing me. I went to Dr. Zangane and I said, I've got to get better.
So, together they found new ways to refine Peter's insulin regimen.
He was slow and steady, but he also gave me that carrot and stick.
It took many, many visits and many success and failure stories until the corner was turned. And of course, with each drug modification, we had some successes. And definitely the mindset, the physical activity, the diet that turned the corner around for him.
New technology was also a big part of Peter's return to adherence.
Peter is a poster child of an individual who has benefited from all these advances in technology and diabetes management.
Peter began using new medications that helped stimulate his pancreas and decrease his hunger. He had also made the switch to the newer, easier insulin pens.
It made it a little easier for me to be compliant. The measurement and that hassle was gone. The fact that all you had to do was dial up whatever it was you were doing made that easier.
After a decade-long struggle, Peter finally overcame his obstacles to adherence.
Really, it's the real thing. When I started doing my part, it made it easier. The fact that I was seeing positive, concrete results. And for me, it gave me incentive to go the next 3 months.
Peter has overcome his frustration over poor communication and an insulin regimen he found challenging.
Everything has turned around because we decided together to make this change. And it made it easier to be compliant. It was almost like a reward.
His wife Trudy and their friends also enjoy his lighter, nutritional cuisine.
Here I am now, 105 pounds lighter. My A1C is 5.7, which is in what they call normal range.
This is my special spatula. It's my stretcher.
And Peter also finds he can better enjoy the other passions in his life.
What we can learn from Peter's story is you can make the change, and you need better communication. It's very important to empower the patient, connect him to the GPS, but of course the car must be in D, not in P. So the patient must be willing to help communicate, but also accepting responsibility and also partaking in the process.
I'm not done. My goal is to be back up on that bike. Then I'm where I want to be.
New technological advances have helped immensely to improve patients' adherence. There are insulin pens that are so simple to use and accurate. There are the memory meters that people can monitor their blood glucose levels and have them in the memory of the meter, and the continuous glucose monitors that are essential.
You want something like that?
Reese Randall is surrounded by a supportive extended family, and a strong support system is one key to helping people with diabetes adhere to their regimen. Still, Reese has had trouble with adherence, to the point where she almost lost her life.
My mom's really been there for me. Every April 15th, she buys me a present because she calls it my second birthday, because April 15th was the day I went to the hospital.
It's been a struggle for Reese on making changes and trying to deal with her diabetes.
Her main stumbling blocks have been low motivation to stick to her therapy, lack of confidence that insulin would work, and not monitoring her blood sugars.
I want to do what's best for me so that I can be the best for my family. I just would love to have that extra help.
To get that extra help, Reese is about to meet again with her doctor to find new ways to win her battle with non-adherence.
Fortunately, the only thing
Dr. Ball says one potential solution for Reese is more frequent contact with her healthcare providers.
You do well for a short period of time and then you slip. And I see you every 3 to 6 months. So maybe there's not enough contact between the two of us to reinforce what you need to do. My suggestion is that we need to find you a lifestyle coach. A lifestyle coach would be able to talk to you more regularly, ask you about your blood sugars, make sure your regimen is being adhered to, and maybe help you with better compliance. And I'm
Reese's
confident
solution
you
of
can
a
do that
life
because
coach
you're
might
very
not be for
intelligent.
everyone with adherence issues, but a strong support system is. And sometimes that support needs accountability, along with encouragement.
I think having a lifestyle coach or someone like that could definitely help me with my goal. And I really was excited about that idea. I thought it was a really new solution for me.
She is hopeful that more frequent feedback and guidance will help her stick to her monitoring and insulin therapy.
All right, good luck till I see
Reese
you
is
again.
also enthusiastic about some of her doctor's other possible solutions, including refresher education sessions, nutrition counseling, and how new technology might help keep her condition under control.
If I can show that I am maintaining and following regimen, then he feels I'm responsible enough for the pump. And the pump is a device that can really help with my insulin and staying consistent throughout the day with my readings.
But even with new technology and the potential for a pump, treating diabetes depends primarily on the patient. Most of what Reese must do to stay healthy is self-administered. That's why adherence takes constant commitment. Still, Reese is confident she can do it, and so is her doctor.
So she has seen the complications associated with poor control and the rewards with good control, and she's educated. So I have hopes that she will respond to her circumstance and keep on endeavoring to improve her blood sugar.
I know that's going to be a challenge. I definitely am going to need the help. And I know to live out that next phase in my life, I'm going to have to.
Reese knows that adhering to diabetes treatment is well worth the fight. But she's learning, as Charlie, Sherry, Erica, and Peter have, that it often takes overcoming some tough obstacles, defeating denial,
Now that I've accepted my treatments, I feel better.
improving outlook,
I know I need to take my insulin to be around for my family.
getting past perception,
I'm not embarrassed anymore about my diabetes, and that's helped me stay on track.
connecting with your doctor,
Our communication got better, and my compliance got better.
and accepting both responsibility and assistance.
I'm doing better with my insulin now, but I know I need help to get to where I need to be.
We can have a picnic.
We're just going to take it easy, have a good time.